Hello, I would like to discuss with you today why we need a national health insurance. And as I said, the national health insurance will control the number of visits, not to tell you to go to doctor or not to go, but the referral. Is it productive, or is it just to help other doctor economically and sending them some patients, as we can see, sending a patient for colonoscopy, for example, in huge number. In 3 Veteran Administration hospitals in Florida, we had 10,000 people undergone colonoscopy within few months, and all of these do not really need a colonoscopy. The first thing is the huge number of medication they prescribe for patients. As I mentioned in my last video about this lady that have been taking 16 different drugs for treatment of diabetes, blood pressure, and cholesterol. She doesn't have a serious end-of-life disease. She is very regular, very healthy woman, but the lab result is not actually the actual metabolic activity of her body, where the determining factor in giving her all this medication. And some of this medication, she's taking 16 different medication, some of them 3-4 times a day. This woman is taking 80 to 90 tablets a day. When I met her first, I used to call her the moving pharmacy. She had a shopping bag with 25-30 different bottles, and having every few hours swallow 4, 5, 6 tablets. As I told you in my last video, that she got chronic kidney disease, and we hopefully will be able to reverse it for a little bit. And this is one case of overprescribing. They giving her 6 different medication for a blood pressure that stayed the same as before and as after she's taking this medication. I think her blood pressure was 110 over 96. And remember that you can't really take one blood pressure medication or measurement and prescribe your medication on it, because blood pressure can go up and down 20 to 30 points a day. And the best way is to take 10 reading, averaging them and see if. But they never did that to her. They just go to the clinic, one visit, sit with the blood pressure machine, the machine says this, they give her this medication. And this is something we have to look at, and I think the health insurance will require that repeated, like the average blood pressure. With diabetes, they're giving her over medication. With cholesterol, it is the same. So there is no need to overprescribe any medication under our national health insurance. The second thing I would like to talk about is the referral. I know a guy that went to his eye doctor to do eyeglasses, and the doctor told him, I would like to refer you to a friend of mine to do some surgery in your eye because you have glaucoma. And the guy said, I never know that I have that. So he went to another eye doctor. Then the other eye doctor told him, you don't have any trace of glaucoma. You might have very, very early stages of cataract, but this is due to your age. And then the third thing I would like, besides the referral, as I said, we sometimes refer patients because we would like to help other doctors economically. We give all this medication, and with each medication there are side effects. So the patient exhibits the side effects of the medication she or he is taking. Cosar, metoprolol for blood pressure, and once the side effect shows up, they don't decrease or increase the medication or adjust the dosage. They start treating you with another medication that might also have other side effects. Like you got muscle cramps from Cosar or from other medication. Then you give you muscle relaxant so you can still stay with the drug. So this is also problems we have to deal with and should be addressed. If there is no direct benefit from the doctor for referral you, then all the referral will be legal and legitimate. Thank you for listening, and I will see you in another story for the need of national health insurance. Thank you and have a good day.